This year, breast cancer became the most common cancer globally, and it's the most diagnosed cancer among American women. An estimated 30% of newly diagnosed cancers in women this year will be breast cancer. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. As we start October, we're focusing this month on breast cancer awareness. This week, we're talking about the importance of early detection, screening guidelines, and what you can be doing at home to aid in early detection. I'm here today with Dr. Ruby Meierotto, breast radiologist with St. Luke's Cancer Institute. Thank you so much for joining us today.
I'm so grateful to be here. Thank you for having me.
So why is early detection so important for breast cancer to a patient's treatment and outcome?
Early detection gives our patients the best chance at treatment success, and that's why mammograms help save lives. Since the widespread use of mammography, deaths from breast cancer have decreased by nearly 40%. And besides mammograms, early detection can also include a yearly clinical breast exam by a healthcare provider, as well as quickly reporting any self-breast exam changes.
Okay, so what are the current screening guidelines?
There are several different guidelines out there by different organizations, and it's very confusing. But here at St. Luke's, our breast experts follow the guidelines of the American Medical Association, the National Comprehensive Cancer Network, American College of Radiology, and American Society of Breast Surgeons. They all recommend a screening mammogram once a year, women ages 40 and older at average risk. Now, women at high risk may need to start yearly mammograms before the age of 40, and then these women should participate in our high-risk breast clinic.
Okay, now let's talk about 3D mammography. Why is that so valuable for patients?
So the 2D mammogram only acquires 4 images, or 2 of each breast. The 3D mammogram acquires around 64 images, or 16 times more than that of the 2D mammogram. Now these additional images allow radiologists to detect up to 54% more invasive cancers with then fewer false positives or false alarms. And then know that we have the most experience here because St. Luke's, we were the first in the Kansas City area and entire state of Missouri to offer this advanced technology.
That's great. So are there any reasons why someone should get a mammogram outside of the normal screening time?
Yes. So a woman should get a diagnostic mammogram instead of a routine screening mammogram if she or her healthcare provider notice any breast changes, such as a breast lump, skin indentation, skin thickening, any nipple changes, such as nipple inversion or fluid leaking from the nipple, for example.
Okay. Now, can you tell me about FAST breast MRI and who should get that exam?
Yes, the FAST breast MRI, also called abbreviated breast MRI, takes only the essential sequences from the traditional MRI so that it's half the time. Now, this exam is not billed to insurance, so there is a $400 out-of-pocket fee, but studies show that breast MRI can detect more cancers than mammography alone. So adding it to the routine screening mammogram once a year gives us the best chance at early detection. This exam is geared towards average risk women with dense breast tissue. Women at high risk should continue with yearly traditional breast MRIs.
Okay, great. And those high risk factors, that's something that we're going to talk more about next week in our segment. But next, St. Luke's employs only fellowship trained breast radiologists. Why is that so valuable for patients in terms of who's reading their mammogram?
So most facilities in the Kansas City area employ general radiologists who not only read mammograms, but then also imaging of the head, the chest, the abdomen, the bones, etc. And studies show that specialized breast radiologists, we read 10 times more mammograms per year in comparison to general radiologists. We have fewer false positives or false alarms. We find more cancers, and those cancers are at earlier stages. So at St. Luke's, we not only offer the highest quality exam, 3D mammograms and breast MRI, but with the highest level of interpretation. And that's why we only employ fellowship-trained breast radiologists.
Fantastic. So is there anything else that you would like people watching to know?
The Pandemic has been incredibly challenging, but especially for women, many of us have taken on additional caregiver responsibilities on top of our pre-pandemic duties of balancing work and family. Too many of us have postponed that yearly screening mammogram, and unfortunately, we're detecting more advanced cancers because of that delay. So, ladies, we need to go take care of ourselves and go get that mammogram because you never know if it could help save your life.
Well, thank you again, Dr. Meierotto, for joining us.
Thank you so much for having me.
If you'd like to find out more about how to schedule a 3D mammogram with St. Luke's Breast Centers, visit stlukeskc.org/mammogram. Next week, we'll be talking about what extra steps patients who are at higher risk may need to take and a unique program St. Luke's has designed just for them. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.